Thank you, Madam President. And I realize it's on the amendment, but it's a strike-all amendment. So we're all very excited and hopeful that this will become the bill. I want to reflect a bit because when I first joined the legislature 4 years ago, I was invited by Representative Arconti at the time to visit the Danbury, Connecticut Childbirth and Women's Center, a long name for a birth center, the only birth center in the state of Connecticut. And that was the beginning of my efforts to make sure that we had the proper licensure. And I've seen that licensing bill turn into a magnificent bill that addresses so many more needs than simply the issue of licensing. But I feel very, very excited about this bill tonight because I have had the opportunity to get to know our birth center very well over the last 4 years. And a number of people, including the Commissioner, Juthani, and Miriam Miller, and a number of my colleagues who are here in the chamber and from the House, did make a tour of the birth center this year. And I was so proud because I had the belief that this is a great place for a person to deliver a baby. But what I felt the greatest pride of is that when I heard the professionals at the birth center answer the many, many questions that were asked, what if this, what if that? And I saw the way they could answer those questions with confidence and gave us all confidence that this is really a good thing. I want to say that over the past 4 years, I've had the opportunity to speak directly with the nurse midwife who runs the birth center in Danbury, Kathy Parisi. She's been incredibly important to adding to what needs to be in this bill. Doctors Blau and Whitcomb, who started the birth center, have become good friends and incredible advocates. I've known now that in just talking to people about this, people start telling you, oh, I delivered my baby there, including Representative Mary Wielander from the House, who delivered at the Danbury Birth Center. And everyone has had wonderful things to say. So for me, this is a really important bill. It serves our community so well. We learned on our visit that 20% of the people who are delivering babies at the birth center are receiving Medicaid. This is incredibly important. This is a resource that is available to those who perhaps don't have the finances to deliver in the hospital. I've talked to women who say, I wanted to deliver there because it's a matter of choice, that women should have, people delivering babies should have the choice of where they deliver and how they deliver that baby. So this bill is incredibly important. I appreciate the governor's efforts. I so appreciate the Department of Public Health, the commissioner, and all the people that have been mentioned that have worked on this. I appreciate our chairs, our ranking members, our vice chairs. One of our vice chairs had a baby during the whole process this year, Representative Parker, and Representative Marks joined me, Senator Marks joined me on the tour, and it's just been, it is really a wonderful bill, and I hope that there's unanimous support for it. I think that it addresses the needs of people in Connecticut. It will address needs where there are maternity deserts we know exist in our state. It will work for people who live where there are alternatives, but they choose to deliver at a birth center. I'd like to see our birth centers grow, and I believe this bill is the first step. So thank you for giving me the opportunity to express my great gratitude to all of the people that have worked to bring this bill forward tonight. Thank you.